Hey everyone, thank you for attending my presentation today. My name is TJ Brantley. I'm a second year doctoral student in the kinesiology department here at UNCG, studying exercise oncology. And my presentation today is exercise preconditioning and how it preserves skeletal muscle function and stunts tumor growth in male mice. Just a little background information. Cancer cachexia is a complex muscle and fat wasting disorder that results in death in up to 1/3 of cancer patients. Currently, there are no clear diagnostic criteria. Its effects are irreversible and it cannot be treated. So a great need exists to better understand this disease. Current research has shown that exercise has a positive impact on preserving muscle mass and inhibiting tumor growth, but there's still a lot of questions regarding the timing, safety, and underlying mechanisms of the benefit of exercise. Therefore, the purpose of this study was to examine the effects of preconditioning exercise as a protective measure for cancer cachexia. So the methodology for our study, mice were separated into 4 groups that either underwent 8 weeks of progressive treadmill training, which is our training group, or remained sedentary, which is our sedentary group. After that, it was followed by a 4-week sedentary period of either being tumor-bearing or non-tumor-bearing. And then grip strength, muscle mass, and tumor growth were measured to examine the protective effects of exercise in cancer cachexia. So the first thing that I want to look at with our results is the gastrocnemius masses recorded at endpoint within our 4 groups. Overall, we see that the sedentary groups express lower gastrocnemius masses compared to our treadmill training groups. But what I think is most important about this graph is looking at how the treadmill training group that was also tumor-bearing expressed significantly larger gastrocnemius masses when compared to the sedentary tumor group, showing that exercise does have some effect on protecting or preserving muscle mass. That being said, I do think it's important to note that gastrocnemius masses were normalized to body mass, so that should not play an effect in our results. So here we're looking at grip strength, which is a measure that we use to look at muscle function, and it's presented as a percent change. So if you see a positive number, it means that their grip strength increased from baseline to endpoint, and if you see a negative number, it means that it decreased from baseline to endpoint. So we see that the non-tumor groups actually had an increase in grip strength from baseline to endpoint, and we see that both tumor-bearing groups had a decrease in grip strength when compared between baseline and the endpoint. But I think the important thing to look at is actually that we see that the tumor-bearing group that went through the treadmill training protocol actually saw a significantly smaller decrease in grip strength when compared to the sedentary tumor group, showing that exercise not only plays an effect in protecting or preserving muscle mass, but it also plays a role in protecting or preserving muscle function. So now we're getting into tumor characteristics and how exercise plays a role in tumor growth. Here we're looking at wet tumor mass, which is just the mass of the tumor once it's extracted from the mouse. Here we see that the male sedentary tumor group experienced significantly larger tumor masses when compared to the treadmill training group. As you can see from the graph, it's actually a 2-fold increase when looking at treadmill training group compared to the sedentary training group, showing that exercise does play some role in stunting tumor growth. And here we looked at estimated tumor volume, which is just another tumor characteristic used to look at tumor growth. It's calculated by measuring the length, width, and height of the tumor. Those values are plugged into an equation, and then that gives us our tumor volume. You see similar trends here that we saw on the previous slide, where the sedentary tumor group experienced significantly larger tumor volume when compared to the treadmill training group. If you look at the data, it's actually a 16-fold increase when looking at the sedentary tumor volume compared to the treadmill training tumor volume, which is a stark difference and shows how much of a role that exercise can play when preventing or stunting tumor growth. So what does this mean? Our results show that preconditioning exercise is capable of eliciting a protective effect against cancer cachexia-mediated declines in muscle function and mass. We also show that preconditioning exercise is capable of preventing or stunting tumor growth, and that these benefits may last for a period even when exercise is ceased. This data is critical in understanding the importance of exercise in cancer cachexia and how the timing of exercise can play a major role in protecting survivors against the effects of cachexia. I want to thank everyone for attending my presentation and hope that you all enjoyed it. Thank you all very much.